All right. Welcome, everyone. Good evening. Good evening. Welcome to another episode of Telehealth Tuesday. This is your go to podcast for insights on modern healthcare and wellness solutions. I'm Dr. Michael Bookhardt, your host, and today we have a very, very special episode lined up just for you. Before I tell you all about our next very special guest, I want to let you know that Telehealth Tuesday can be viewed on multiple platforms, including our YouTube channel. That's Dr. B TV, the word DOCTOR spelled out, letter B is in boy, TV, and also our Instagram and Facebook pages alike. Please follow, like, share, and subscribe to help make sure that you support this very important program because at this time we are not sponsored. And so this is specifically brought to you out of the kindness of all of our guest hearts. So we are doing this for you to benefit not only the citizens of Jackson, Mississippi, or the state of Mississippi, but all around the world. And we have had guests from all around the world as well. So without further ado, I want to tell you all about Dr. Jennifer Bryan, who is no stranger to the world of medicine, especially in the state of Mississippi. I want to tell you all about her, and I known her for a long time, and she was actually one of my attending physicians. That's one of our instructors during our residency program at UMC. This is a seasoned board-certified family medicine with a career in both community and academic medicine, intertwined with executive level organizational leadership, known for effective interpersonal and mass communication skills, health policy expertise, and very effective short and long-term strategic planning abilities. She is the most recent and the past president of the Mississippi State Medical Association. She's also worked closely with both state health officers, continues to do so. She continues to do so in the best position for citizens of Mississippi and also physicians. She currently serves as the chairman on the Mississippi delegation to the American Medical Association and president-elect. Well, okay, we talked, but she's immediate past president of Mississippi State Medical Association. She's contributed to multiple national news outlets such as CBS News, the Washington Post, Fox Radio, Los Angeles, Newsweek, and Vanity Fair, amongst many other state and local media platforms. Dr. Bryan truly possesses the insight, relationships, executive leadership, and experience, government affairs expertise, networking, and communication skills necessarily for organizational leadership. Woo! Now, if you're not impressed by that already, I want you to just get a chance to hear her all for yourself. So, ladies and gentlemen, without further ado, stand and cheer for the one, the only, Dr. Jennifer Bryan. Give it to her. Absolutely. I think it was just getting maybe cut off just a little bit. Can we test one more time there? One more time. I think it's getting, it was kind of chopping a little bit. I know when we tested earlier, it was perfect.
Now?
A little bit. Yeah, I think that's better.
Okay.
Yes.
And I
Yeah.
pop out back in.
Okay.
Can we do that?
That might be. Let's try that. We'll pop back out. Let's do it. We got our hello to our, there's simply Ace 58. What's going on? Thank you so much for joining over there in Instagram land. Quick Fix LLC. That's Jasmine Briscoe. I know who that is. So it's so good to see you. And thank you to all our new viewers. We got Gerald Richardson, my main man from Memphis, Tennessee.
I'm here. Is that better?
Back there. All right. Okay. Let's try one more. How about that? Testing one.
That's 1, 3.
I think that's, yeah. Let's see. Okay. Perfect. How are you feeling?
Oh, great. I'm glad to be here with you guys tonight.
Awesome. That is wonderful. Look, we've got, let's see. I'm saying hello on our next screen to our viewers and fans over in Instagram land. So can you, Dr. Bryan, can you hear me? Can you hear me well?
I can hear you fine. I hear a little bit of an echo when I hear myself back.
Awesome. Yeah, I think that sometimes the guests have that issue. Because see, I started using the headphones because you don't have to, but when you use, I think it might sometimes go into the microphone, causes a feedback. But it should be maybe. I think sometimes if you just got a little bit closer, if you can, that was that was better. I think the mic picks up better.
Okay. I mean, I can hear myself, but it doesn't bother me as long as y'all can hear it fine.
Okay. Okay. Yeah, he's okay. Dexter said she's still breaking up. Yeah, I'm not on face. Oh, he's watching on Facebook. Yeah, I'm not sure because I know when we tested.
Mhm. Is it better when I turn the video off?
No, not necessarily. No,
How's
it's
that?
not. Yeah, that's better. I think it's just probably the mic. That's what it is. Probably.
Well, we're gonna just see me up close and personal. How's
There
that?
we go. There, yeah, that's better. I think that's what it is. Yeah, that's perfect. I appreciate.
Okay.
Thanks, Dexter. Thank you. So we
Sorry
want.
about that.
Oh no, no problem. Thank you so much for joining us, and I hope please let our guests know if there's anything I left out. I was reading off the bio, but there may be some things you want
I
our
think
guests
the
to know.
the main things I'm excited about are recently getting elected to the American Medical Association Council on Science and Public Health. Very excited
Absolutely.
about that and the work that we can do around the country. And then I've started a company and clinical AI safety, and that's really a passion of mine.
Yeah, absolutely. Yeah, I'd love for you to tell us about that. Before we get into the prepared questions and everything. Tell us all about that, and how you came up with the name and what inspired you to come up with your company.
So, as you know, I'm a family doctor. I work with Hattiesburg Clinic in Flowood and have used various medical electronic health records in the exam room and just seeing a lot of stuff coming into our charts that worries me, not only for the patients who are seeing diagnoses maybe that they don't carry, but also for physicians who are busy and other clinical care providers that are getting diagnoses into their chart or maybe plans that don't make sense.
Hmm.
And the risk that goes with that of signing a record that's not accurate, or worse, billing for those things like HCC codes, as we get paid for the complexity of a patient, it's becoming more important that we need bedside governance, not audits after the fact, but really an ability to have transparency. Where did you get this suggestion from? I see
Hmm.
that you've suggested rheumatoid arthritis. Where did that come from? And
Hmm.
is it accurate or not? Right. So we need confidence
Absolutely.
levels. We need to be able to trace sources before AI diagnoses pop up in the chart. Now I'm pro tech, but I'm about delivering care to the person at the bedside and having
Hmm.
transparency. So we wrote national policy to that effect and kind of started a company about the same time. So very
Wow.
excited about leveraging tech, but also doing it responsibly.
Yeah, absolutely. That's you're really on to something there because I noticed the things you talked about. We do see that from our colleagues all the time, and sometimes it's that they could be a great physician or a great provider, but they just don't know the justifications or the things behind it. So I
Well, I
think
think every
that's amazing.
January, if you're doing value-based care, you have to reassess and each diagnosis, and that can be
Hmm.
burdensome when there's 25 things that you've got to remember, and there's a lot of trust involved. So we want the tool, but I need the tool to be accurate, and that is what we're seeing is so much stuff coming in, and it takes time to track all of that down. I want to know where it came from. It can be done. Um, we're
Absolutely.
turning on bells and whistles and dashboards, but we need to start back with the basics. I don't advocate pen and paper again, but when I had pen and paper, I knew what I was putting in the chart. So
That's
it's
right.
coming at us from all directions, and there's risk involved in signing those things. So that's the space I'm in, but also that's billions of dollars when you push it across the country. So I think we've got some improvement to do.
Yeah, absolutely. Absolutely. Um, I see we've got some other folks coming in. You guys join in and listen, even though we have, like we say, every Tuesday at 7 p.m., just because we have prepared questions, we are here to answer your questions live. Dr. Bryan is here. We talked about her experience. We talked about the new company she started. But if you guys have other questions, we're going to talk about the health and state of Mississippi, and most of our questions are focused on that. But we are here to answer your questions live. So please keep them. I know I see Jasmine Briscoe there. I know she's Dr. Bryan. She's a good friend of mine. She's here every episode.
She's a good lady, and I like to see the feedback there that yeah, I'm not the only one seeing this. So I
Absolutely.
just take the claim. I filed my first patent. I didn't even know what I was doing, but I did
Really?
it. So we're going to see if we can make a difference.
Oh, that's awesome. Well, go ahead, Jasmine. I know you probably have a question on. She's going to relate everything back to lymphatic drainage and massage, and she's always, but she's fantastic. But all right, so one first question, wanted to jump right in. Mississippi is often ranked near the bottom, unfortunately, in overall health outcomes. But and I think we all have our own ideas for that. And, I actually right before this. It was on WJTV, and I did something about juvenile obesity that's airing tonight and on the news at 10 o'clock. And so we were talking about the overall health in the state, and especially with children between the age of 10 and 17. And so, but my question is, why do you think that Mississippi is often ranked near the bottom in overall health outcomes? And what are the biggest factors driving that?
So first, let me say how proud I am of you getting out there and doing media like that and this podcast. It's so important for
Yeah,
physicians to
thank you,
speak up about these issues because we can't fix them if we don't shine a light on them.
thank
It's very complex in Mississippi, as you can imagine, and I'm sure you already understand. Um, I think COVID didn't help us any.
you.
But I will say that we're
Absolutely,
coming off the bottom. We're not dead last anymore, and we're making great strides with Dr. Dan Edney's leadership at the health department. He's very
yes.
committed to public health initiatives here. And as you know, during COVID, the State Medical Association and the health department were joined in a joint mission in getting the word out about misinformation and disinformation. And with that relationship has come a lot of collaboration over the past 5 years on things like substance abuse and access to food and access to health care and coverage. So when you think about why, I mean, certainly we've dealt with poverty, and that is
Hmm.
an ongoing problem. However, I do see things changing. We're seeing the economic situation seems to be on the uptick in our state. I'm no economic expert, but I can definitely tell that there's some positive signs there and new industry moving into the area. We lost a lot of nurses during COVID. That has created kind of a barrier to care as well, and having to build back that workforce. We have a physician shortage. Um, we continue to grow more doctors. So we have two medical schools now, and we have the Office of Physician Workforce, which is phenomenal with new residencies around the program, funding the Rural Scholars Program. So really putting money into medical education because so much of access to care is just that we don't have enough people to take care of all of our citizens, but we're working on it and we're getting better. And I think using tools like AI and tech and telemedicine, all of these things extend our presence. We've got a rural hospital crisis. We have an access to healthy food problem. Like if you're in a rural town and your your town has a fast food shop but not a grocery store, it's not always a choice for some people to eat healthy. And we have been working. I went to school with the ag commissioner Andy Gibson, and
Hmm.
he's really committed on supporting farmers and getting access to healthy food to rural Mississippi, to all Mississippians. And so there are a lot of places that we're collaborating with people and a lot of reason for hope to get better. And I think with Dr. Edney's leadership, we're headed in the right direction.
Absolutely. And you talked about, excuse me, access to food. And that was one of the things we talked about on the WJTB interview today as well. And especially for these kids, just they don't have access to, clean water. Some of them not having access to appropriate food and these food deserts and all that kind of thing. So, yeah, I think you're spot on with that. And also, from your perspective as the past president of the Mississippi State Medical Association,
Mhm.
what would you say, which of the health trends kind of maybe worry you or concern you the most right now in our state?
I think that really we've got a trust issue in medicine.
Mm,
And those of you on here that are practicing medicine know exactly what I'm talking about. There was a time when the physician was the most trusted profession out there. And
absolutely.
I think it's dangerous because our values have not changed and the scientific method has not changed. And yet, we've got more people with more voices, and certainly social media has amplified that. And while all people are equal, all education and training is not. Like, I
That's right.
don't proclaim to be an accountant. I don't proclaim to be, a school teacher. I don't know what those stresses are and educational requirements. But in medicine, I'm confident in what I know and I stay educated on it. So when you don't have trust,
Mm-hmm.
um, patients are believing voices that all have the same volume on social media, right?
Mm.
So
Okay.
you're getting their evidence from and their suggestions from people who are not trained in medicine, and we're seeing a lot of the rise of some wellness products which are good and some that I think are scamming people, and that's dangerous. And we're seeing a lot of mental health crisis post COVID, and with social media the way it is now with AI and all the chat bots. So there's so many concerns that I have that are trending right now. But
Mm-hmm.
I think all of that revolves around our interaction with tech in some way as to how it is either escalated or dealt with.
Mm-hmm. Absolutely. Looks like Jasmine Briscoe has a question. Let's get that up there. Are we collaborating more with doulas, bodywork professionals, and personal care providers? I don't know if you want to
That's a
tackle that
great
one first.
question,
Okay.
Jasmine. I mean, I think the simplest answer I can give to that is that the dollar dictates a lot of that. Until insurance is reimbursing people to do bodywork professional visits,
Mm-hmm.
and they don't. Like, so many people can't afford a gym membership, and that's difficult. There are some plans, but for the most part, no.
Mm-hmm.
Doulas, I know there has been some talk of it, and I know that the health department is having those conversations. Dr. Edney would certainly be able to give you more insight onto that, but I have heard them talking about that specific conversation about, how we improve maternal infant health care in Mississippi, which is a priority for all of us. Um, but I do know that that's part of the conversation. As far as personal care providers, give me a little bit more information. Are you talking about concierge type medicine, or is this something entirely different?
Mm, absolutely. That's a great question. Jasmine, while you're responding, and I think that also with, like Dr. Bryan was saying, in terms of the experience of the provider or of the physician when it comes to working with others, because, Dr. Bryan, I don't know if it's been the same in your experience, but for me, since I've been out, I've just seen that a lot of our physician colleagues, for whatever reason, they don't collaborate with others. Whether it's massage therapists, whether it's chiropractors, whether it's naturopaths or herbal medicine. And me personally, I mean, I do all of that, because I
Hmm.
believe that that we can have healing not just in medicine. So I personally, and even on the show last year, we featured Jasmine twice as a guest on our show, and then we've had a doula, as a husband and wife
It's
doula
great.
team. Yes, out of there in Nashville, Tennessee. And so anyway, Jasmine, just kind of my experience, anecdotal. I think there's just a lot of providers that may not
I
be
think,
comfortable or some.
just to kind of follow up on that,
Hmm.
I don't think I have not experienced so much that it's a lack a lack of a willingness to collaborate.
Hmm.
It's different because you're a physician, and so you're able to say, "Hey, I suggest this," and that's based in the fact that you understand what is reasonably safe for a patient.
Hmm.
And what we are seeing, I know the health department has seen some products are not that are being sold, and really seeing detrimental effects. So it goes back to the source of the information too. And
Hmm.
then when you do have a collaborative relationship with a physician who's a partner and advisor, then those services certainly get extraordinarily safer, right? And backed. So I know in my own practice, I have had patients buying from unscrupulous people that there was some really toxic stuff. I saw a lead poisoning once. I saw a
Oh.
mercury poisoning. So there are bad actors out there, and it's just all about who is advising you and where you're getting that advice from. And certainly, when there are responsible people in any avenue, you hear us talking to the ag commissioner
Hmm.
that wants to improve people's health. I'm for it.
Absolutely. And you touched on something before, and we were I was just having a conversation as well before this episode where we were talking about the mental health. You touched on that. I mean, and I'm just, going to go off the script of our prepared questions for a second.
Sure.
What, in terms of either the data or even just your experience with mental health and all the work you've done with the state, what, what is truly being done about that, because it's just getting worse and worse, becoming you know,
So one thing that we did was increased and added a slot for a psychiatrist on the Rural Scholars Program. So for those who are watching that don't know what that is a state-funded legislative initiative that started out funding family medicine primary care doctors that go into rural areas. And now, there are slotted positions there for psychiatry because we know not only do we not have enough doctors, we don't have enough psychiatrists.
absolutely.
So that's the first piece of that. I know that we have been collaborating, with the jail and prison and law enforcement system on. We know that we've got a problem with people who are mentally ill being incarcerated, which is not the best place. So we're working on bed capacity and making sure that we have a safe place to go, collaborating with nurse practitioners, PAs, and other mental health care providers like psychologists and counselors all around the state to
Mm,
build up almost like a system of care there to help deal with it. But it's still a work in progress. But
yeah,
I do know that the legislature is very aware of this, and every year there seems to be more and more funding behind it because those who study history know that on the tails of a pandemic, there's almost always mental health issues, depression, and
absolutely,
all of it. And we're still dealing with that. Like we like to pretend like it's over, but it's not over. And a lot
definitely.
of the things that we see with mental health these days are on the heels of the COVID mitigation efforts and all of the problems we had there, the political arguments back and forth. Now we're throwing in tech and social media. So it's all snowballing, and we've got to get ahead of it. And I think I'm heartened by the fact and have hope that it's on everybody's lips. All of the people that are in leadership that I talk to understand, and we've got great bipartisan champions down at the state legislature and at the national level that are looking at really putting their feet to work and getting a fix. But it's not going to be overnight.
Yeah, absolutely. Well, that's definitely I'm you. This is even comforting for me to hear because I haven't. I want to make sure to become a lot more active, and perhaps you and I can talk about that later.
Yeah,
To get more. Yeah, because I really enjoy doing these things, but I have not been as active. With the MSMA and the MMSA, and both.
both great groups. Yeah, I
Yeah.
think if you're in medicine, you're in politics these days because everybody's coming at you. I will point out
Yeah.
that Dr. Catherine Panel is the newest president, and she's a psychiatrist. And Dr. Avni
Mm,
Patel just got elected to our AMA delegation, and she's
yes.
an excellent psychiatrist. So a lot of the physician champions for MSMA are also psychiatrists. So it is increasingly on our radar, and we are taking more and more mental health policy to the legislature.
That's awesome. Awesome. Real quick pause for the cause. Ladies and gentlemen, if you don't know already, we are here with Dr. Jennifer Bryan. We are discussing the health and the status. Where are we right now in the state of Mississippi? What are we doing about it? What are we doing about mental health, as you just heard, and where we're going and our goals for the future? This is Telehealth Tuesday. We are here each and every Tuesday at 7 p.m. For your viewing and listening, not only pleasure, but edification and education. And so we thank you so much. I see the couple of numbers are shooting up there, and want to say hello to our Instagram family on our other page. See Miss Tamara Logan that's my high school classmate from Orlando, Florida. Big shout out to Dr. Phillips High School. So we okay, Miss Baker's there. All right, good to see you. So I wanted you all to know that, and also this is episode 54. Every Tuesday, Dr. Bryan, we've been here,
It's
God willing,
great.
every Tuesday, 54 episodes.
It's
So
impressive. We should all model this example of speaking up. And even if you don't get
thank you.
everything 100% right, that's what I learned during COVID. You're talking about it and you're starting the
Yes,
conversation and saying that the health of the public and the health of the state matters and
that's
how
right.
are we going to do better. So I applaud it. And also, if I could just
Yeah,
say, To those of you who are just tuning in, the reason my face is in my phone is because we had some
Yeah.
connection issues at the beginning with the audio. I hope that's better now. We
Yeah. Oh,
tested
much
it,
better.
but I didn't mean to be in the middle of your phone screen like this.
Yeah. It's okay. Now if you want to try back it up, it might have just been an initial connection. If you want to
Is it
try,
better now? Or do I get
that's
the feedback?
that's better. Yeah. It's okay. Say it one more time.
Hello, it's Jennifer Bryan.
Yeah.
Is that
That's
okay?
that's good. Yeah.
Okay, good.
That's good. Well, we were just talking about. Excuse me. We were just talking about mental health. We were talking about what leadership is doing in the state, all the way to the national level. There's some exciting things going on in the leadership, and then also Dr. Avni Patel, who's a psychiatrist. So basically, letting you all know that there are people in leadership who are actual psychiatrists, and so we talk about a lot of our, and these are not just patients, these are not just arbitrary people. These are our church members, our family members, and friends, people, and not just the random person you see on State Street talking to themselves and mumbling and with no clothes on and all that. But these are real people, and this is a serious problem. So all right, let's see. Right now, and we talked about so obesity. These, I know that people sometimes you get a little burnout hearing about it, but I mean it's not going away. So obesity, diabetes, hypertension, heart disease, these are major problems. Dr. Bryan, what would you say? What are some practical steps that families can take right now to turn the tide on these things?
So the first thing I want to say is don't get overwhelmed. Rome was not built in a day, as they say. And so think about the next positive step you're going to take. If it's having more fruit for snacks, do that. If tomorrow it's taking a walk, find something simple, start your first goal, and then make it a habit. And and I think they say you've got to do something 14 days for it to kind of stick. I would definitely encourage walking. I recommend 30 minutes a day, 5 days a week as a floor. Start slow. If you can't walk because of your knees, look at an elliptical. Get in a pool. A recumbent bike is great on the knees. Lift some easy weights at home. If you don't have weights, some heavy cans will work. I have just
Mm,
it's about moving, avoiding processed foods. When it comes to obesity, we've got several tools outside of that. So talk with your doctor about it. I'm on a committee down at the legislature that Lieutenant Governor Hoseman appointed me to that's looking at insurance operating in our state. And right now, while we are woefully undercovered with a lot of the pharmaceuticals that can help with this, you're thinking Ozempic, Zepbound,
mhm,
Mounjaro, Wegovy, all of those, Trulicity. I'm sure I didn't name all of them.
mhm.
Increasingly, we are working with insurance companies to get that covered. So it's not right for everybody, but for a lot of
Yes,
patients, we know that it helps fatty liver and kidney disease and heart disease and
yes.
reduces the risk of obesity associated cancer. So we want to get that more affordable and accessible and covered for people across the state. And I'm feeling very hopeful that that's coming and that's helpful. So it's a mix of lifestyle, both diet and exercise. Don't get overwhelmed. I don't know if you remember, Mike, but I used to teach y'all in residency
Mhm,
that if a patient comes in and their weight has not gone up and it stayed the same, that's a win.
mhm.
You,
Absolutely, that's right.
I'll
I
have people
remember.
come in and say, I only lost 5 pounds. I'm thinking, it's amazing. You didn't go up because
Right.
it's hard. And it's not just a willpower issue. This is a disease state, and
Mhm.
we have a lot of effective tools, and we're getting better at it.
Absolutely. I think, and you're right. I remember you saying that and years ago. And honestly, I took that page out of your book and I use it all the time. And had a lady come in yesterday and she said, I think her weight was 249, something like that, 259. So, and she was saying she wants to be, I think, around 220. So with 35 pounds to go. And she said, Dr. Bookhardt, I'm doing everything. I even started on, I think she came in as a new patient on Ozempic. And she was like, well, I think I may need to go up to the next dosage. I'm not losing. I said, what? I said, wait a minute. It's still a victory, I said, because you didn't gain. And she said,
Hmm.
I never looked at it like
It
that.
absolutely is. It's mindset. And there we know that even independent of weight loss, if you're walking, it lowers your blood pressure. There are a lot of benefits to a healthy lifestyle besides what the scale says to.
That's right. Absolutely. I always, my mother's here basically and living with me in Mississippi. And so Lily James, we may see her name flash on there because I can tell and I hear the echo. I know she's watching. And, I don't know if you've had the same experience with family members, but man, it doesn't matter how long you've been doing this and how effective you are and how good you may think you are at it. But, you know, family members and especially parents, man, I feel like they just still see you as, that little kid is. You're like, listen, this is what you need to do. But they don't really take it so seriously and start doing it until somebody else says. So maybe if she comes on, because I've said these same things, you got to get more active, you got to walk. She's trying, she's making efforts. So,
I saw
but
a quote the other day that said, "You see people," it was something to this effect, in the highest level of position of power that you ever interacted with them, like your whole life.
mm,
So if you can think
mm,
about your kindergarten teacher or your parent or whoever was head of the school that you went to, even though you may gain in stature and professionalism and leadership and so on, still that person seems just ahead. And I think we're that way with our parents too, that they always
mm,
seem, and they, I mean, they are in a position of importance, but it
hmm
matters. My dad can still jerk a knot of me or in a second about if I'm doing something wrong. So
yeah,
there's a question
yeah,
about,
okay, yes.
let's see what,
Sorry, Miss Baker, that one right there.
yeah.
How
How
accessible?
accessible is it for new patients to access medication and treatments that don't have diabetes? Okay, great question.
Yeah, great.
Um, Not as accessible as it needs to be, but there are options. So one thing with a lot of pressure out of Washington, the manufacturers brought the pricing down to direct access for I think $4.99 a month, which is still extraordinarily expensive and not affordable for most people. But it is way better than over 1,000. And we do have some patients who, if you want to pay $500 a month, it will probably work. And if you are the right patient for it, it's accessible. Talk to your doctor and you can get it directly from the manufacturer. Um, but insurances are now covering it more and more for sleep apnea. It just got the indication by the FDA this week for fatty liver. One of them did. They don't all have the same indication. Some for chronic kidney disease, some for heart disease. If you think back, I mean, they deserve to make their money theoretically for doing the research. So I
Hmm
understand the push and pull a little, but
Right.
we've got to find a balance since we have such an obesity problem. So we are hopeful. We are very hopeful, and we know that it can be discounted deeply in mass purchasing, like for different insurance companies and so on. So I think we'll see more haggling over the next year or so, and this is going to become increasingly accessible. They are liberally sampling, which helps as well. So, and there are other
Absolutely.
options, as you know. Like I like Contrave a lot, which has Wellbutrin and naltrexone in it. As
Hmm
far as the massage therapy question,
Let's
probably
put that
not. I
up
mean, I'm just
there.
being honest with you right now. I don't see anybody talking about massage therapy as recovery treatment. That doesn't mean I think that's not a good, I mean, it's probably a good idea. What I would encourage doctors in Mississippi who are listening to this call, when you have an idea that you're personally passionate about and that you have a lot of expertise about and you see a need, write a policy and bring it to
Mm,
the House of Delegates of
mm.
MSMA in August, and your colleagues will beat it up back and forth about, well, have you thought about this or have you thought about that, and then come out with something meaningful, and then you've got an entire association that's advocating for your idea. So I haven't heard anybody talking about that. So if that is a good idea that we need to pursue, would love to talk to you more offline about something like that.
Let's do it, Jasmine. I knew that question was coming, Jasmine. I knew it was coming. But that's an excellent question. You see, there it is, Dr. Bryan. You see, let's put it up on the screen. There she is. There she is.
There she is. I
Yeah,
see.
yeah. Um, okay, and then we've covered that. Let me make sure we don't miss anything in Instagram. Okay. Now, so let's talk about this. We talked about the Rural Scholars Program. You had mentioned it, As we all know, Mississippi has a large rural population. Um, how does that, the location of that geography, how does and lack of resources, how does that impact the health of our communities?
Oh my goodness, that's such a such a complex question. It
Yes.
seems like it's simple, but it's not. So, I mean, as you know, we have one academic medical center in the state that sits in the center of the state. And the coast has a good community, healthcare community. Tupelo area does. Hattiesburg has a good one, and Meridian's got pretty good health system over there. Vicksburg has some, but it's a problem when you need access to specialty care, particularly. And geography, when I think about rural hospital closures, if they were to happen, my goodness, at how much worse it would be. So they are our lifeline because there's an entire connected system of care through MedCom, that has been thoughtfully arranged. And when you show up in rural Mississippi, how you get to Jackson or Memphis or New York, wherever it is that you need to be. Um, but the system breaks down when the pieces of the system are not there. And so I just can't stress enough how important it is to advocate for our rural hospital sustainability. The other issue we touched on briefly is access to healthy food. Our geography
Hmm.
definitely affects that. And many communities only have fast food options if they have anything, and some don't have groceries. And one thing I learned at the legislature this week when I was down for that committee meeting is that there was a law passed a couple of years ago that actually municipalities can invest in farmers markets like directly for their communities. I believe that's how Hattiesburg did theirs. And I hope that more local governments will look at that and really setting up fresh markets around the state for people to have access. Um, Think about transportation. Not everybody has the car in their driveway to just go hop in. So I think that is also an issue. Like we have many people that just cannot get transportation to see the doctors that they need. And then, or they don't have the gas money and so on. Or maybe they're really busy with a career in a rural area and can't break away. But certainly geography is a limiting factor. How are we combating it? Because I always want to turn it around with hope.
Hmm.
We are bordered by a lot of cities. When you think about Birmingham, Memphis, New Orleans, Mobile, the state, and then Jackson in the center, the state has many options around us that are within 3, 4 hours, which is good for serious diagnoses and so on. So we kind of have this safety net around us somewhat. But telemedicine is really important, and I want to say it's more than Facebook. It is I can look in your eardrums while you're at home, or you don't have to leave work. I can listen to your heart sounds.
Hmm.
I tested a lot of that technology. I'm not using it right now in my practice, just because I'm spread thin with other things. But
Hmm.
there's some amazing, very affordable technology that people who are 2 hours away from a doctor can absolutely get their heart listened to in their living room by a cardiologist. So it's just knowing
Amazing.
what's out there and availing ourselves of it, and then getting insurance companies to say, you know what, I'm going to negotiate this down. Like I'm talking, I've seen systems that will purchase these in-home kits for $300, and then
Wow.
you the opportunities open up. We need broadband access, and it's not enough to put devices in people's homes. You've got to educate and show them how to use it. And also, the future is looking really good. The state's doing a lot of work with broadband, and we're talking more and more to people about if doctors don't all go live rural, because the first thing I tell the legislature is, let's face it, doctors want their kids to play soccer and go to the movie theater and all of those things too, and they're aggregating in urban areas. But we can do things differently. We can use real telemedicine. UMC has a great network for that. We can expand on it. But the other thing is, in our Facebook group that we started here in Mississippi 7 or 8 years ago, where we have a lot of doctors in there talking, I asked about 2 years ago, I said, would you adopt a county? Like, I know
Mm.
my grandparents are from LaFleur County and Carroll County, and we've got land up there. And if you could make a difference, like if we could make the site of service thing go away, would
Hmm.
you go once or twice a year to the rural county of your choice? And
Hmm.
we'd set up and support you and take care of those people. So many doctors signed up for counties. It's thinking differently. I'm
Hmm.
trying to read what all Jasmine Briscoe's
Oh,
got
you
now.
okay?
I love it.
Yeah, she mobile bodywork
Mobile
professionals
bodywork
can provide. Yeah.
professionals can provide assistance to telehealth patients who need help at home. You've got some great ideas. I think you've
Yeah.
got a policy brain, and we
Mhm.
need to put them on paper and let's talk about them and get some buy-in and start advocating for the things that are important to you. That's what the association's about. Why I love it so much. Your bright idea becomes everybody's work.
Yeah, absolutely. Let's do it, Jasmine. We're gonna connect you. We're gonna connect you with Dr. Bryan, and let's get some things on paper.
We definitely
Yeah.
got a network of mentors. When you've got good ideas, we can help you punch holes in them, figure out where blind spots are, hear your expertise,
Mhm.
and teach you how to. And I don't want, like, you may already be doing this, but generally speaking, when I see somebody fired up about an idea or two,
Mhm.
that's always my recommendation.
Yeah. And it's like so many people. I feel like they'll have the ideas, but in probably it's different for different reasons. They just don't follow through on it all the way, like you're saying, like, go to the delegation, all that. Maybe some people think that they might not be capable, or
You know what it
nobody's gonna
is?
take them seriously, or
It's like everything else. I mean, it's kind of like I sat with my problem in the electronic record for a couple of years. I'm like, somebody's going to fix this.
somebody
Somebody's going to
else is
see
gonna
my
do it.
misery on this pain point, fix it eventually. And then time just went and it didn't. And finally I thought, well, I'm going to try. Why not me?
Why not?
And that's the way it is with all of our legislative battles. I mean, and not just there, but public perception, vaccines, and public health, reimbursement for doctors. It's hard to make that case, even though I know that we are not reimbursed fairly, particularly by Medicare, and that
Hmm.
system is crumbling, and we need reform
Yes.
yesterday. We need prior authorization reform, but
Hmm.
nobody's going
That's
to
right.
come fix it unless we write the policy and we argue it and make the point. So I'm
That's
glad you're
right.
ready to learn more. We'll talk.
Oh yeah. And real quick, I wanted you to know, Dr. Bryan, that on our Instagram, I don't know if he's still there, but the first one who joined on Instagram was Dr. Claude Brunson.
Oh, that's my friend.
Yeah. And yeah, it's been and been also been a mentor to me. And I see DCP MD, that is David and Ardarian Pierre. They said hello, Dr.
Good
Bookhardt,
friends.
Dr. Bryan.
Good
Yeah.
friends. We have such excellent physicians in our state. I always say that Mississippi is really just a small town, and
Hmm.
I didn't remind Dr. Brunson I was coming online, but I could have told you he was going to be here before I
Oh,
logged on because he always is, and I'm sure a
awesome.
lot of you know him too. But you've got no finer representative as far as I'm concerned. Nationally, he represents us so well. He's on the American Medical Association Council on Legislation, and he's the big dog at
Mm,
Congress
I didn't
pushing
know.
the
I
big
didn't know
things. So,
that. Okay, I didn't know that. Okay.
oh yeah,
I didn't know that. Oh man, look, Shannon Myers.
Shannon
Wait a minute,
Myers.
man. Wait
Man,
a
this is
minute.
a reunion.
Yeah, this is. Mom, I don't know if you're still watching, Mom. Because he and I went to med school together as well. St. Matthews over in the Cayman Islands. I remember he was pushing one of the kids in the stroller and all that on the beach.
I talked
Man,
to him not too long ago, and I'm not sure, but I think he was in the Cayman Islands or somewhere that when I talked to him, he was heading out on
wow,
somewhere fun. So,
man, that's
um,
awesome.
there's a question in the chat here
Yeah, let me,
about,
Miss Baker. Let me put that up.
let's see, how has technology, like you said, that technology has advanced. What's your feelings about diabetes monitors? I find myself double checking them, and they're off on some patients.
Hmm.
Great question.
Yeah, yeah, yeah.
uh, Horror story I'll start with first. I grew up with a guy, and he was like one of the dads, and he was actually the dog keeper. And everybody knew and loved him. Wasn't the smartest guy, but like so nice, and just did his job. Faithful servant. He had diabetes. He was one of the first patients that I knew of that had gotten um, a diabetes monitor that monitored the glucoses and then administered the insulin. And he didn't wake up. The alarm didn't go off. That was years ago.
Oh
But I
my.
can remember how tragic that was, that the machine malfunctioned. So a lot of this
Oh.
really is life or death that we get the technology right.
Mhm.
These days, my understanding, and again, I'm a jack of all trades here, so high
Mhm.
level stuff that I'm hearing conversation on is that they are much better. And yes, they're using AI. And I will tell you that mathematically, it is impossible to get all hallucinations out of AI. There's always going to be baked in error into that, just like it is baked in error into humans. And we have to learn to work around it. But we are seeing improvement. That being said, I think just last month there was a recalled lot of sensors, I believe, because they were giving all erroneous readings. And that lot was saying people's sugars were like 100 points higher than they really were. I think it's a tool. I think it's a fallible tool like everything else,
Mhm.
but it's pretty good, and it's way better than when I was in residency. And I think back, and I know the generations before me, when we just didn't have much. I was
Yeah.
still in training when the A1C was discussed, and we didn't even know what to do with it. And it wasn't long before that. You look back, I mean, it was in the last century that we had insulin. So we're
Mhm.
learning.
We
I think
learn.
they're excellent, but definitely keep looking over your shoulder.
Absolutely. Absolutely. Let's see. So one of our next question. So we've kind of touched on this a little bit in terms of the roles of different community leaders and all that, but just kind of wanted to make sure for the people that have joined, we've got several that have joined recently. What role would you say that our state leaders, our churches, schools and community organizations, what role do all of these different organizations, these different people play in helping Mississippians live healthier?
I'll start with the story that in COVID and we faced, and by the way, I was in leadership during that time. So if I say in
Hmm.
COVID, I was chairman for 3 years during that time, and that's all I did was live, breathed, ate, and slept COVID.
Yeah, COVID.
And we, with Dr. Brunson's relationships, engaged the Black pastor community. And that made a huge difference in the uptake among African Americans across our state. And we beat a whole lot of states on vaccine uptake. In the beginning, it was kind of like poor old Mississippi, they're not going to be able to get their vaccine uptake. And so we leaned in. And the faith leaders stepped up. We did press conferences together. We had conversations with community barbers. Really and truly, the partnership with these leaders is really important to um, get the message out, to serve as a resource for health fairs,
Hmm.
to do medical seminars in which I hope all your listeners who are physicians or health professionals will engage and speak. Reach out to your chambers of commerce. Run for office. My goodness. Instead of arguing everybody else about what we think they ought to vote for, there's somebody
Hmm.
on here that wants to run for office. I sure wish you'd let me know, because we'd certainly support doctors running for office. Because the more that we engage in leadership, the more that we can affect the laws. But in Mississippi, we're in the Bible Belt. Your churches want to help. They want to help people who have no access to care, and other nonprofit organizations. They want to help people with no access to healthy foods. And so I think about my partner who his church does a backpack ministry every year, and so the staff all donates, and we give to this church, and then they give the local school kids backpacks full of like school supplies and food. We can do those partnerships all over the place. Reach out to nonprofits and let them know you're willing to serve. Do food drives. The Medical Association did one in December. We raised a ton of money for the unfortunate. People want to give. We are very giving people,
Hmm.
and you can be the face of who shepherds that. You can make a difference in your community.
Absolutely. Um, One of our viewership, welcome y'all. Come on in, come on in. I see people are there just now. I always say, Dr. Bryan, when we get close to the end, it's funny that every week, and I've been saying this each episode, it's like at that last 10 minutes, like where we are now, you'll see like this surge of people and usually several questions. So, but you all come on, we'll do a rapid fire if you come on with some questions. Otherwise, I've got a couple more. Um, and I think we'll probably skip the mental health because I know we've talked about mental health a couple of times. You know, interesting question is, if you could wave a magic wand and change one policy in Mississippi that would improve health outcomes overnight, what would
Mhm.
that one be? Would you say? What would that be?
In some shape or fashion, I would like for every Mississippian to have health care coverage, whether that's Medicaid expansion, affordable private plans, but I want it to be meaningful coverage, not just catastrophic coverage,
Right.
but meaningful access to primary care and screenings. There's so much cancer and morbidity and heart disease and all that goes undiagnosed simply because people cannot afford health care. It has
That's right.
gotten astronomically expensive. But beyond the expense of health care, the insurance premiums have just skyrocketed. We've got to problem solve the access to care problem. And
But you know,
then
oh, okay.
we've got
Okay.
to build a whole lot of doctors and grow the pipeline.
You know, and I'm with you on that. But you know, one thing, and not, you know, of course, we certainly won't go political, or but you that Medicaid expansion. I
Hmm.
mean, I couldn't agree with you more. But and especially the state that we're in, I know a lot of people, and from all the way to the top, there are so many people that just oppose this,
Right.
just because on the politics. So how does one get beyond that? Since
Hmm.
you've been in these arenas and been in the seat, how do you get beyond that?
Well, we're
Politically.
not beyond it.
Yeah.
But I will say that the conversation has shifted in recent years. So when I was young on the board, and have served on the board, I think it's 12 years now, I'm not sure,
Wow.
at State Medical. It was, you didn't talk about that. You
Right.
just knew you didn't talk about it.
No, yeah.
And that was kind of the last of those days. But for years, that's how it was. And then when I was chair, we said, okay, well, we're going to look at it. And so I appointed Dr. Edney, who was not the state health officer, to head up the Medicaid expansion task force. And we met with stakeholders from all over, multiple states, industry leaders, business community, everybody. And we did a white paper and we circulated that to state leadership and so on, and started the conversation. And we introduced policy once people were warmed up to things, and passed. I believe it was unanimous that the medical association was for Medicaid expansion. So that's our policy. But you do have to deal with headwinds and politics. And at the end of the day, I don't really care what you call it. I just want to be able to go to the doctor and for it to be
Hmm.
affordable.
Right.
So the business community wants it because they know that they want their workers healthy and productive, and they know that a physician who is able to be reimbursed, that the economics that means to local communities is it's incredible. You're really an economic engine if you are a doctor practicing medicine. So everybody is for this, and when they're talking about it, what I hear is state leadership knows and wants and people to have access to care, and they do care, but it definitely comes out confusing sometimes to people when
Hmm.
you just catch a sound bite. So I don't
Hmm. That's
know
right.
how this all ends up,
Hmm.
but I have heard a lot of the conversations that we continue to push on innovative ways, and we simply can't have hundreds of thousands of people falling out of the healthcare environment in Mississippi. So stay tuned. We'll see what comes of it, but I do know there's some committed people, just as late last week, that were meeting at the Capitol to try to mitigate gaps and then continue to grow access.
Well, that's definitely comforting, because that was, you know, and when a particular person was president and when some things got rolled out, I know it was just so controversial with the particular the folks that were in office here in the state, and it was so and I'm sitting there thinking, and and after we finished the residency program, saying, man, this is so crazy. We've got all these folks, and even in my training and before, these folks are coming up here just with no insurance, and they're coming to the Baptist and St. Dominic's and UMC and Merit Health, and they're coming there utilizing this as their primary care.
And it's
you know.
unreimbursed care, by the way. The hospitals eat up a lot of charity care, so do physician practices.
Hmm.
So we will see what comes of it, but you know, at the end of the day, somebody has to pay for all of this stuff. And just food for thought, I don't have an answer to this, but
Hmm.
Ozempic's $1,000. That's what we're talking about.
Right.
But some of these genetic designer drugs for muscular dystrophy, sickle cell, and all, like it's $3 million a dose. And how we're going to decide in the coming years as we advance about whose genetic disease gets fixed and who's going to pay for it and how we're going to afford it,
Yeah.
I have no idea. But we've got challenges ahead on how we navigate that as well.
Well, you heard it here. You heard it first, right here, everyone. On 7:59, I think this might be the first episode. I might try to end on time, but I don't know if there's. I would love for you to make any kind of other statements or closing remarks. I always ask every guest to, let our audience know where your practice is located, for you, where your practice is located, what you're working on, and how people can find you and contact you, and are you taking new patients?
Oh, that's right. Good. So I thank you for that. I'm a family physician with Hattiesburg Clinic, Flowwood Primary Care, right here in Central Mississippi, off of Lakeland Drive, down the same road as Raising Cane's Chicken is, up there on Lakeland Drive. And my phone number, I believe, is 601-414-6520. I have to think, but that's right.
Yeah.
And we're on East Layfair. Practice there with some names that you guys may remember: Chris Boston, Stephen Hammock, Barrett Jones, Lisa Keeling,
Yeah.
Andrew Oots. So there's 6 of us there. And
Okay.
we wanted to bring Hattiesburg Clinic to Flowwood, which is a large physician-led private practice. Very proud to be a part of that organization and really
Yeah.
wanting to expand the roots as we see more and more employed setups, which are not necessarily bad. The autonomy of private practice and the value and quality, we really wanted to be a part of that. So we're excited. And then I've got this side thing going with the clinical AI safety, which I believe that we need to return governance to the person at the bedside who
Mhm.
knows the person in front of them, to restore trust, because we're losing trust quickly with people looking at the records and they don't make any sense. And also, you guys don't want risky codes that you're billing for that are popping in on a busy day that leads to clawbacks. So I'm excited. That's my new passion over the past year, working that, because I think it can save a lot of money, maybe even afford health care for some people and make them have better care and safer, more accurate care. But we'll continue on with the general advocacy at the State Medical Association and at the American Medical Association. And if you're not at the table, as they say, you're on the menu. So if you're not a member, I
I like
always
that.
plug, go to msmaonline.com and please join us, because we do this largely for free and it takes a lot of time, but it's a very powerful organization and we could definitely use your support.
Yeah, I love it. I love it. And if if you're not at the table, you're on the menu. Man, I like it. I thought I had a good. I'm gonna give my closing phrase, but I like that one. Uh, Let's see.
I
You,
agree,
you
Jasmine. And
covered it.
I think if somebody's just doing pills or just doing lifestyle, there's some middle ground there for a lot of us. And so,
Mhm.
I would just encourage you to advocate your passion, and you may get more traction. Sometimes I look around, like I said, why anybody else doing it? Speak up,
Mhm.
then it becomes policy, and policy becomes law.
That's right. That's right. I love seeing MDs as advocates to their patients and really mean it. Yeah,
Well, I do
just
really
makes a
mean it. I've been doing
makes
it
a
20 years, and I'm so thankful that you
yeah.
guys have afforded me that opportunity. But I'll give you the piece of advice that a mentor gave me, which is just to show up. You learn so much just by showing up to meetings and events, and you get a little bit more confident the more you get around it. Pretty soon, you're a subject matter expert on things. But I didn't start out as a policy expert.
That's right. Absolutely. Well, we'll leave it there. I'm going to do a quick, if Dr. Bryan, if you would just, I'm going to do my quick closing statement. And then if you'll hang on once we go off live, so we could just chat real quick, if you don't mind.
Absolutely. Thank you all.
Yeah, absolutely. Well, thank you all so much. We want to thank Dr. Jennifer Bryan for being here with us. As you can see, she's got a wealth of knowledge and experience. And if you missed it, you know where to go. Dr. B TV on YouTube to catch the replay, and also Facebook, Instagram, and also LinkedIn. That where you can catch all 54 episodes, but you can definitely catch the replay here. We'll put that out tomorrow. In addition, we have an amazing guest next week as well. Now, I usually always say it's gonna be a surprise, but I will tell you that I think that she is probably the most popular or talked about African American female commercial pilot right now. And we discovered her on Instagram actually, and but she had a conflict. She was going to be on this upcoming Tuesday, so we'll see what gets worked out. But I usually don't even share that. But you guys stay tuned. And again, if you missed it, please make sure to go back to Dr. BTV. You can watch this episode with Dr. Bryan and all of our other 53 episodes. So make sure, and if there's somebody you want to see, please let us know, DM or email us if there's somebody you want to suggest that you'd love for us to have on the program. If you yourself want to be on the program, please let us know. We hope you'll join us next Tuesday. Make sure to bring a friend. Don't only come with yourself. We want to see you, but don't hold this just to yourself. Share this knowledge and these resources with somebody else. So bring a friend, bring a church member. All right. So God willing, we'll see you next Tuesday at 7 p.m. This is the place where we treat and discuss mind, body, and soul. And remember, here it is, Dr. Bryan, my closing phrase. And remember, true wealth begins with good health. See you next time.
Good night, y'all.
All right. Let's